Good morning, Carol Johnson.
Good morning, Bob. How are you?
I'm good. How are you?
Doing good, doing good.
hmm Beautiful day in the neighborhood, like Mr. Rogers used to say.
Yes, absolutely.
Yeah.
We've had some great
Um.
weather lately.
Yeah. So before we start talking about our COVID update, there's something I want to mention that I think is important in a related way. So I want to remind people that we have a a primary election coming up next month, June 22nd. And it's a very important election because over 70% of the key elected officials in New York City government are going to change. So basically, next year this time we're going to have almost a brand new government, elected government in New York City. And so the question is not whether we have a brand new one or not. The question is whether we have the one that we want. And so I think it's important that we remind people of there's two things. One, that it's an extremely important election. We're talking about a new mayor. We're talking about in Manhattan, new district attorney, new borough president. Um, there's so many city council seats that are up for grabs. And the second thing is that there is a new system called ranked choice voting that's important for us to understand because this time when you go into the voting booth, you don't just pick one candidate. You can pick up to five different candidates: your first choice, your second choice, your third choice, fourth choice, and up to five choices. And the reason why this is important is that if your first choice doesn't get elected this year, what happens is, for example, in mayor, we have 13 different candidates. So it's very, very likely that it's not going to happen on the first run is not going to have enough votes for any one person to have the majority needed to be declared the winner. So what they're going to then do is then they're going to eliminate the lowest vote, and then they're going to go to second choices and third choices. And the ranked voting is important for us to do because it gives us the power to continue to have our vote at the table in the subsequent rounds. And so it's important, A, that you do it, B, that you rank the candidates that espouse your values, you think will represent you, and C, it's very, very important. You do not put, if you have one candidate you really like and you put that candidate five times, it's not going to help at all. So don't do that. So I just wanted to give that quick public service announcement and also a reminder that if you want to vote in the primary, the last day to register, if you're not a registered Democrat or a registered Republican, then you have to register by this Friday, May 28th. So that's my public service announcement.
Well, let me give you kudos and a shameless plug to you, my colleague and friend. Great show in the Soul Lounge, the
hmm
Night
You,
Watchman.
you watched it good. All
Yes,
right.
I did, and it was,
Okay, good.
it's so informative because it was on the right choice um, voting, and it was a great show. It gave me a lot of information. You
hmm
know, so I mean, guys, WHCR 8 p.m. 90.3 on Monday nights.
Yes.
Is the place to be. Take the time to check it out. Always a great show. Every time I
hmm
tune in, always a great show.
hmm
Lots of information. And let me say, too, that we got to remember that we didn't fare as well as we should have during the census.
That's right.
And so now having come out, having our communities being underserved
hmm
for so many years,
hmm
as long as we've been in existence, we've been underserved.
hmm
And so the census takes place every 10 years. We did not do as well as we should have and we could have.
Right. Right.
You can't say the boots were out there on the ground, trying to sign people up. And so now that it was so important because We're in in this pandemic. We
Mm-hmm.
lost a lot of resources. So it's really, really important that you focus on these elections here. You have to find somebody that you think is going to get us out of a major crunch like we've never been in before.
Mm-hmm.
It's going to be that much worse this year.
Mm-hmm.
So we need to get out and vote. We need to register. We need to stop thinking my vote won't count,
Mm-hmm.
and get out there, do the right thing, and make your voices heard.
Mm-hmm. So important. The funny thing, we've seen in this country how there's been this pushback in terms of voter suppression. And this is really bad in the South. But our issue here, and in my show, the consultant Vincent Thomas talked about it. Our issue is not voter suppression. Our issue is a lack of voter turnout.
Right.
And so that's really something that we have to address in our community internally. That, while, our friends and family members in other parts of the country have to jump through all types of hoops and might have to travel for miles just to be able to vote and go through all the changes, and now they made it illegal to give people water on the line and all that stuff. We don't have any of that. We can go right to our neighborhood polling place and put our vote in. We can send it in by mail. We can do early voting. There's all these things that we have an opportunity to do. But if we don't do them, it's really on us. So we really, have to bring our awareness. And my concern is that the energy that we had in November, it's like we got to get Trump out. Everybody's like, I'm voting. I'm voting. They're wearing their buttons. I voted. Did you vote? People were challenging people. Did you vote? Are you registered? And that energy is part of the reason why we were able to, you know, get rid of that previous administration that was creating so many problems for us. But the thing is that a lot of the problems that we had resulted from those years of inactivity where we don't pay attention during the primaries, or we don't pay attention toward, off year elections. And you know, that's when the other side comes up and they sneak up and they push things and they push their agenda and they never stop. And then, all of a sudden we find ourselves 2 years later. It's like, I thought we were winning and we're going backwards again. How did that happen? And it happened when we took our foot off the gas during elections that don't seem as important, but they really are.
Yeah, and it's really time that we take a new approach. As
Hmm.
you said, people fought hard to get the vote. People
Hmm.
died to get the vote. And
Hmm.
New York is much more progressive, where we haven't seen those things yet. We have different things in place to sort of stop it. But at the same time, we're still suffering from other things that's happening in a lot of these states.
Hmm.
Injustices, racial injustice, inequities, inequalities. We're still suffering from those things here. So as
Hmm.
long as we have an opportunity to be present and to be vocal,
Hmm.
and make our voices heard, so that people listen. See, that's the problem with our communities. We don't speak up. And
Hmm.
so people just disavow us. And then
Hmm.
we start complaining. And you can't complain when you're being disavowed if you're not present.
Hmm.
But this is the time, like never before, that we have to do the right thing, and be conscious of the choices that we make
Hmm.
and step up. And the registry process is a very simple one. You can register online. It's a very simple process. It's not a long process. You can go to the Board of Elections and, excuse me, and sign up. And then, more importantly, show up. You can do absentee ballots,
Hmm.
you can do ballots in person, but make your voice heard.
Hmm. Yep. So remember that date, June 22nd. only a few days after Juneteenth, you know.
That's right.
So, you know, we should be talking this up in all our different community organizations, we should tenants groups, making sure that people have an awareness, making sure people not only look at the candidates and figure out the ones they want to vote for, because now it's really important. If you only vote for one candidate, you're not getting all the power out of your vote. And so that's the thing about this ranked choice, is that when you break it down, it's actually, something that empowers our community to have more power in our vote, but it only works if we use it. So if we don't use it and other communities use it, they're going to have better results in terms of what their choices are. So we need to be proactive, but we also need to be defensive. That if we just ignore it, oh, I'm just going to go in and I'm just going to vote for one and not look for the others, and then when you see how the election rolls out, it's going to be like, oh man, we got the choice I didn't want at all. I could have gone with this one, or this one. Well, if you had one, two, or three, then put them in there, one, two, or three. Or if you have five, then put all five. But make sure you take the time to actually learn who's running, um, figure out whether they are people you want and don't want, and just get out there and vote like it's November and Trump is still in office and we have to get him out. That's how you have to vote.
Yeah, and there's a lot of candidates, so this is the time to really, really pay attention. There's a lot
Hmm.
of, you can go on YouTube if you haven't seen any of the mayoral
Hmm.
forums. You can go on YouTube. You can Google
Hmm.
mayoral forums in New York City, and you can see different Zoom rooms where they've been out and they've been answering questions and pertinent questions,
Hmm.
and get a feel of who's running,
Hmm.
because we can't afford to make any real mistakes this time.
Yep.
Can't afford it. We are so far beyond behind the eight ball that we
Hmm.
cannot afford to get just anyone in there. But without the participation of the voters, we'll end up losing out. So
Right.
we can't say anything when other communities get certain things, when they get street lamps, lights, when they get post boxes, when they
Hmm.
get bus stops, different things that we fight for in our community, dangerous areas, lighting, street lighting, different things like that, funding to your senior centers and your youth centers. You can't complain because other communities are getting these things because they show up. They show up, they participate. And so now, after this pandemic, I mean, I don't even think people realize how emaciated we are, financially, economically. What that's going to look like in the long haul.
Hmm.
In neighborhoods who have lacked so much of everything over decades and scores,
Hmm.
and now it's really not good. It's really
Right.
not good. So we got to get up out there and vote like people did back in the 50s and the 60s, fighting to get the right to be heard. And now you have the opportunity. You don't have to fight. It's already been done for you. Now all you need to do is show up.
Right. You need to fight to get off the couch.
Right.
Right, to get out there and do it,
Right.
or if you don't want to get off the couch, go on your computer, get that absentee ballot mailed to you, and you can mail it in,
That's right.
you know. But be heard, be counted, or then be silent. We don't want to hear you talking about it next year about all the problems when you didn't do what you could do to help it.
Right.
You know,
Absolutely.
you know. It's like, I don't like the new mayor next year. Well, did you vote in the primary? Because that's how it works here in New York. More than likely, the likelihood is that the person who wins the Democratic primary is going to win. Now, it's not a foregone conclusion. We might end up, with the Democratic candidate being somebody who's really not the choice that we want. and then all of a sudden the Republicans have somebody, who they run. Now, it's a low percentage, but I heard they were trying to run Curtis Lewa,
Uh,
of the Guardian Angels, who's, but he's a household name in New York. He's been around. Is he my choice for mayor? No, absolutely not. But you can't discount these things. He's like a Donald Trump. It's like one of these characters. You say, "Oh, he couldn't be mayor," and the next thing you know, he could be mayor. Because you weren't paying attention. So, get out there, and bottom line is, if you like Curtis Lewa, if you like Donald Trump, you still need to get out there and vote. So if I offended you with my own choices, then you better get out there and get your choice heard. Whatever you do, you need to vote. So we're equal opportunity about that. I'm not
yeah,
shy about sharing my opinion, but my opinion is everybody needs to get out and vote and be heard. So that's our little public service announcement. It
yeah,
went a little bit longer than I expected, but
it's okay.
it's that important. So
We're an informational network, so it's okay.
right, right.
Yeah,
Because this primary is going to be gone on June 22nd. COVID is still going to be around.
absolutely. And I
Yeah.
tell you, I get at least two calls from the campaign, Sleewa's campaign, every single day, including Saturdays and Sunday. So, this guy is really really pushing.
hmm
So I mean, let's just do the right thing.
Yeah. Yep.
But like
All
you
right. So
said,
what do
it's
we got to
still
talk
kicking,
about for
still
COVID?
kicking.
So the Moderna people are trying to get in on the teen vax sweepstakes. They've announced that they've had good trials with their vaccine in the 12 to 17 category, and it's interesting because they're definitely behind the timeline. And let's talk a little bit about this because yeah, in our last show we talked about it. The Pfizer vaccine has been authorized for 12 to 17, and they're trying to expand that and do a lot of outreach to get that group vaccinated. But there's a time crunch where they're really going to be pushing these youth vaccinations over the summer because once it gets toward going back to school, there's a window where if you get a COVID vaccine, it's going to prevent you from getting other vaccines because the CDC recommends that you not have another vaccine 2 weeks before and 2 weeks after, I believe, your COVID vaccine. So it basically means that if they're not vaccinating youth in the summertime, there's going to be a point in time in the summer where parents are going to have to make choices in terms of either getting the COVID vaccination or all the other vaccinations that kids are supposed to get, which is a whole another story. But the point is that there's a push on now to vaccinate. And you mentioned that you felt like there are some logistical problems in terms of how this is set up.
Yeah, certainly. Of course, they're asking for permission from the parent, but the permission before the vaccination takes place. So that means at the site of the vaccination,
Mm-hmm.
they have to have that permission. Now, it could be in person, it could be by, I don't know, wasn't clear on whether you had to sign a letter or if there's a consent form available, or it has to be done by phone. My question is, how can you legitimize the consenter and the caller as being an adult, as being who they say they are?
Mm-hmm.
I mean, let's face it. We were savvy as kids, and shoot, I know kids are a lot savvier than we were.
Right.
I remember actually my friend showed up as my mother at school, and she was younger than me.
Uh huh.
you know, but she was tall. She had that look. She put on some makeup, She, put on some. She's tall anyway. Put on some heels, and that gave her like the overpowering um, look. And so, I mean, parents, we need to be having a talk with our kids.
Mm-hmm.
We need to talk to them about this vaccine, because if it's a possibility that your child can actually get a vaccination without you knowing about it,
Mm-hmm.
without fully understanding that they may have health issues that may um, question their ability to take that vaccine. These are
Mm-hmm.
questions that you need to have with your doctors,
Mm-hmm.
conversations you need to have with doctors, but a lot of times kids act on things and they don't have all the answers because they don't know how to ask the questions. But it's something serious that you need to talk to your kids about, because that possibility exists, you know.
Mm-hmm.
So you don't want that to happen. You also
Mm-hmm.
need to talk to them, period, if you want them to get the vaccine.
Mm-hmm.
Help them to understand what it's about, as much knowledge as you can. Listen, the internet is loaded with valuable, pertinent, honest information. We stay on our phones, we stay on our laptops all day long.
Mm-hmm.
Just explore and go through this. Make it a project with you and your children. And the vaccination levels are going to be dropping to lower than 12. And so this is the time where you can bring your 7 and your 8-year olds in on that conversation too. Just keep
Mm-hmm.
it very, very simple.
Yep. So let's see what else is going on in the COVID news. There, there's some. They're reporting that the CDC is no longer investigating mild breakthrough infections, and I'm not sure what that means yet. Okay, but first of all, let's talk about the term breakthrough infections to make sure people understand that when they hear that term. And breakthrough infections basically means people who have been fully vaccinated and still get COVID. It doesn't happen a lot, but it does happen, and it's one of those things where I just feel like we need to kind of keep an eye on this because I always notice when people's language around things start to get a little vague and watery. And so let's see if I can bring up. There was something I was reading on this morning that gave me pause. you, you know, sometimes they just hide things in the way they put language about it. Okay, so like all right, so this is from medpagetoday.com, where we a lot of times get a lot of our information about some of the new things that are happening. So they're saying the breakthrough infections are rare, most were mild, and the majority of them came from variant strains of the virus, which makes sense in the things that we've heard. But further down in this article, they mention, however, investigators did note that the total reported cases among the fully vaccinated likely represents a substantial undercount. So, so you basically,
Wow.
they give us the numbers and they say there's no cause for concern, but then they tell us that, oh, but don't trust our numbers.
Yeah.
So these are
Now you see why we do this show every week.
yeah, because we actually read these things that people send us. It's and I have like a instinct when I hear these little terms like breakthrough infections. It's like there's somebody somewhere who's paid to say something that's really bad and make it sound like it's something good. Like breakthrough infection. That sounds like something I want to get. Wow, I broke
Right,
through.
right. You know. Now you see why reading is fundamental.
It really is. It really is. And I got the same sense when I was reading this thing about the Moderna vaccine. And so, all right, I'm gonna like peek behind the curtain on this thing a little bit. So, we do this show every week, and a lot of time it's about, okay, let's go through the stories that make the most sense. And usually, I just want to report the story. I don't want to say there's anything wrong with it. But sometimes when I read these things, it's like, whoa, what are you guys really saying? And so, um, with the Moderna thing, they were basically saying that this trial was set up to, um, basically, they wanted to make sure that the same effects that they were getting in the adult trials, they were getting in the teen trials. But then they hide the information somewhere where they're saying, all right, but we're not exactly using the same methods to look at it. So, after the second shot, now they're using some sort of other way to measure it. And it's just when you start to read these things and you see these changes in language, it just sounds like the little kid was like, did you eat up all the cookies? Well, what happened? What was going on? And then with the Moderna thing, as I said, I think it's more of a Me Too type of thing because the Moderna announcement is not an emergency. They have not been approved by the CDC or FDA or um, any of the organizations that need to be approved. What they did is they had a trial which has not been peer reviewed yet, and it hasn't been submitted to the FDA. So why they're announcing it now is because when they finally get their approvals, they don't want people to think that Moderna is not in the running for the 12 to 17 demographic, which is so important to them, because at the end of the day, these vaccine manufacturers are in business to make money. And I'm not disparaging them because their product is obviously working based on the numbers we see. But let's never forget that their business is to make money, and they really love it when it starts from literally from the cradle to the grave. They want people to be vaccinated. So, with this push for the 12 to 17, we just advise everybody to look at it. We advise parents to look at it. We're not saying there's anything wrong with it. We're just saying that we all need to take more responsibility for our own health choices and outcomes. And especially as we're in this phase, we need to start going back to really, consulting with our doctors, looking at our individual um, medical situations and determining what makes sense. You know, you,
Yeah, there's always a possibility with this that it
mm-hmm,
flip back in the direction we came from.
mm-hmm,
So we cannot let our guards down.
yeah,
People are just still getting very odd information, or I don't even know if they're getting odd information. I think that it's gotten to the point where people just want to believe what they want to believe.
mm-hmm,
And so no matter how many people, and I've experienced this personally talking with people, that no matter how much information you're given, you're so COVID weary that you want to get out and you want to live, but you're
sure.
still getting the fact that COVID still exists.
Okay, we have a technical difficulty there. Okay.
I apologize for that. But
Mm,
COVID can still kill you.
yeah.
And so
Hmm.
I had a conversation with neighbors yesterday where, I happened to notice that a few people got in the elevator and the rest of them stayed out. And I said, well, oh, good. You're still paying attention to social distancing. And so one of them said, that was outside of the elevator, says, well, that's okay. We've been double vaccinated, so we're safe. I said, well, if that were the case, why are we still wearing masks? you know. And why didn't you get on the elevator? So the fact that you're double vaccinated does not mean that you cannot get COVID. And even when you think about it, just read up on some of the cases. You don't want to get this thing mildly. You don't want a mild case of
No,
COVID.
no,
You don't want
because
any COVID involvement whatsoever.
mhm,
So you want to protect yourself. And then they had a young child with them, a teenager
mhm,
with them. And so if this is your thinking, you're not passing the right information off even to your child.
mhm,
You can't be in households. You can't be
mhm,
inside with your friends, you know, um, in the room hanging out, on Xbox or whatever boxes they're using now, gaming and everybody's laughing, nobody's paying attention, you know. And like I said, these are young adults. These aren't, they're like young adults. So
mhm.
2021, that segment was getting infected. Kids had a different form of it, something like the Kawasaki's
Right,
disease.
right,
But it just goes to show that if the parent is not informed, the kid's not going to be informed.
right.
So they're still thinking, well, I got both vaccinations, but what about the people on the elevator? Did they? And there's somebody on the elevator that's not wearing a mask.
Mhm,
It's a small area. There's like 8 people in the small area, in this small area. So
mhm,
it's summer, summer's coming, and there's going to be a lot of outdoor activities. But the best way to enjoy this time and to keep those numbers from going up again is to try to make sure your activities are outside,
mhm,
in the parks, in the backyards, and everything. And still remember that everyone is not vaccinated and everyone without a temperature may have COVID. So you still got to remember that
mhm,
and just stay safe and make your own distance from people,
mhm,
and keep it that simple. The protocols have not gone away. Still
mhm.
got to wear the mask, still got to wash your hands, still got to do those things. But you really can't go based on what someone says. You know, I got both vaccinations. Okay, so everybody take off their mask. You cannot go by that.
And part of this was because of the CDC coming out and changing their recommendation on masks for vaccinated people. But interestingly enough, there are a lot of epidemiologists and other healthcare professionals, nurses union came out and basically are disagreeing with the CDC mask guidelines. Feel like number one, it's is letting up too soon.
Hmm.
It's creating confusing messaging, and I think their intent was to make it look like if you haven't gotten vaccinated, that getting vaccinated would be your way to not have to wear a mask. And I just feel like they're not addressing the fact that the people who aren't vaccinated and who aren't wearing masks are not going to now get vaccinated to not wear masks because they weren't wearing masks to begin with. you know People who are wearing masks may or may not want to get vaccinated, but more than likely maybe they will be more incentivized. But the people who are not wearing masks and not getting vaccinated are going to continue to not wear masks and not get vaccinated. It's just that they will have less pressure on them to not wear a mask because now they can just say, well, I'm vaccinated. And who's going, in most situations, there's going to be no check on it. Especially in some of these southern states where they fought the whole mask thing from the beginning to the end, and now the CDC is, relaxing their guidelines for vaccinated. Well, you can't just relax it for one and relax it for the other. So, the short answer is, we continue to recommend people wear masks and practice social distancing, especially in indoor situations. Do everything we were saying last month and the last year to do. You probably still need to continue to do that. The numbers have been going down, but they're not. They have, there's still, there's still a lot happening, and there's still, um, you know, 580,000 plus people who died from this. And here's the part that we're also not hearing about, and I wanted to talk about this and restart this conversation today, is that our health officials, I don't hear them talking about COVID recovery. And remember, if you know 32 million COVID survivors in the US, and that's based on the ones that were tested. So we know 32 million people are living with some form of having had COVID. And so what does that mean? What are the implications? We've heard about the long haulers, but I haven't heard the Department of Health talking about long haulers and talking about what do we need to do to monitor and provide relief for the people who are having ongoing problems. We've heard it in terms of heart issues. We've heard it in terms of gut health and digestive tract issues. We've heard it in terms of brain fog. We've heard it in terms of sleeplessness. We've heard it in terms of there's so many different aspects of the long haulers that we have seen little data about. And I don't see any mobilization of our city, state, and federal resources to address the 32 million Americans who are dealing with some form of COVID recovery.
What's sad about that is, of course, if they're still having problems, they're going to go to their doctors, they're going to go to the emergency room, whatever their source of medical treatment is. But the CDC, the WHO, and different agencies that's been on top of this, they're not having that conversation with the medical community.
Mm-hmm.
Because the bottom line is, if you are a PCP and I someone comes in to see you and they're saying, well, I've got pains in my joints. You have a lot of people that don't even realize that what they have is COVID related. They
Mm-hmm.
just don't make the connection. One of the reasons why people don't make the connection is because people may know that you have COVID, but because they have so little information, and the fact that we sometimes take information from unknowing people before we get information from people who have some sense of knowledge about
Mm-hmm.
certain things, they talk them into, well, you're getting older.
Mm-hmm.
You probably got arthritis. You
Mm-hmm.
probably have this, you have that, and so when they go to the doctor doesn't even know where to look
Mm-hmm.
or how to look. They're not versed on what this COVID, post COVID looks like.
Mm-hmm.
They don't have any information on that. So they're just going to simply send you to a rheumatologist
Mm-hmm.
who deals with arthritis, bursitis, different things like that.
Mm-hmm.
But the thought is that the people that's really studying this would be the immunologists and what's the other one? Virologists. Those are
Mm-hmm.
the people that's studying this. And so would the doctor even think, I need to send them to an immunologist? My patient had COVID. And this is, somebody needs to look at them because they're the ones that's seeing all of these different factors that you just named.
Mm-hmm.
And they can actually document them, do the proper testing. Other than that, these people could be running around taking test after test after test after test because nobody's really looking at COVID related illnesses. And so these conversations need to be had with the entire medical community. Doctors are baffled. Of course they're baffled. Of course they're baffled. Who's like, is there a playbook going out now to the medical facilities? If you have patients who present this, who present that, patients that had COVID, who come with these different type of ailments. This is what we need you to do. Is that happening? So I mean, I know so many people with so many different complaints. They're coming up like every day something changes.
Mm-hmm.
And they had COVID and they really, really don't know what to do. They don't
Mm-hmm.
know where to go and they're not getting any answers. They're just taking tests. You
Mm-hmm.
know, there's so much that was just botched,
Yeah.
for everything, for every emergency, there is a playbook.
Mm-hmm.
But they weren't reading the plays.
Yeah.
It was just
Well.
kind of, well, let's do this. Oh, that didn't work. Well, let's do this. Oh, that didn't work. And this one's going this way, and this one's going this way. And then they butt heads. And then they
Mm-hmm.
say, okay, we're both going to go in the same direction. And one says, I don't want to play anymore. I'm leaving. And they go and they make their own decision. Meanwhile, it's the people who continue to suffer.
Mm-hmm.
And this is not going away. They cannot sweep this under the rug.
Mm-hmm.
So if there's anybody out there, as they call the long haulers, you really need to be having some serious conversations. Create some coalitions like everything else. People with cancer, people with sickle cell. We've got all kind of coalitions of people that fight.
Mm-hmm.
And if you're one of them, somebody needs to take the strongest voices and advocate and pull together and say, listen, we need help. Go online, go online. Go on Facebook, go on Instagram. Usually, the community help. Facebook has this thing called community help, where you
Mm-hmm.
can put a message in there. You know, I have some situation going on. You can even say a friend, somebody has a situation going on, COVID related. Long haulers. Anybody else out there suffering with this? Let's see if we can get together and talk about this.
Mm-hmm.
Person, but online and get together and talk about this and again fight and advocate for yourself.
Yeah. We should always remember that the way we got through this whole thing was together as a community. So we need to continue to use those community resources and keep your eyes and ears open. And you got to listen to what's being said to you and really filter it and make sure it makes sense to you and your life situation. And if you don't understand something, question it. You know, that's what we do every week. We question what's going on. We're not here to, poo poo or anything. We need to know the real facts. And from day one of this, we haven't ever really gotten a full straight answer from all of our various elected officials. We would have one thing coming from the federal government, something coming from the state, and something coming from the city. And rarely, if ever, are they all on the same page. We're doing better now, obviously, but we still want to give people the full perspective of what's going on. So the last thing I want to talk about today before we wrap up is just for us to also understand the whole global vaccination politics, because we're in dead in the middle of that, and it's something that we also need to just be aware of. So one of the things that happened this month is that the WHO approved Sinopharm, which is a Chinese vaccination, for their emergency use listing, which is, I think, similar to our emergency use authorization that we have here in the country. That's the WHO world version of it, if you will. And so we're going to see more and more of the China virus vaccine rather being talked about. Sinopharm, along with Pfizer, Moderna, and AstraZeneca, and the Johnson and Johnson. And the reason why these things are important is because so many of countries that did not have the resources and who are not getting the same amount of vaccines, and it's becoming an issue in terms of politics. And so, even as we talked about the vaccine of teenagers here in the US, there are People were saying there's an article in the Atlantic. You can go to theatlantic.com and read this article about how there are people who are saying, hey, let's back off on pushing the teenagers, and we need to send more vaccines, to some of these countries where, like India, where the vaccine is raging and they don't have enough vaccine shots. And, for people to remember that as long as the pandemic is going on anywhere in the world, it can come back, at any time. So, not sharing the vaccine is not necessarily a good thing for us or for the world. Um, Now, the other thing that we've been seeing is that um, the Biden administration promised some vaccines to Mexico and Canada, but interestingly enough, they promised the AstraZeneca one, which they haven't approved here, but the AstraZeneca has been approved in Europe and some other places. So there are different political games being played with who's got the vaccines, which vaccine do they have, who's going to get them, and a lot of these things don't necessarily affect us here in the US, but it's really important that we kind of pay attention to these things, because the world is connected, and ignoring the plight of other people during a pandemic is ultimately not going to be a good long-term solution. So it's important for us to pay attention, and especially pay attention when we look at black and brown countries, when we look at Africa and we look at the Caribbean. We need to take a look and see, well, what type of access are those countries getting to the vaccine. When this whole thing was created, they created this thing called COVAX, where there's supposed to be a set aside for countries, for the justice situation, recognizing that there were going to be a bunch of countries that didn't have the check writing capabilities to just go out and buy vaccines for their whole population, and they still needed to get the vaccine. Well, this COVAX has been kind of a joke. It's been underfunded, it's been underutilized, and they've gotten very, very little actual vaccine doses for those countries.
Mm-hmm.
So, these are just things that we need to obviously keep an awareness of.
Yeah, it was a good idea because it was surging all across the world, and it was like, "Come join us, come,"
Hmm.
and everybody joined in, and then all of a sudden, all those countries that joined in were sort of like just cut out of the mix, you know.
Right,
And now, I mean, the numbers are rising in Canada again. I mean, look, they're right across the border from us, people,
right.
not 20,000 miles away. They're right across
Yep.
the border, and since
Hmm.
we can go every and anywhere now, you know, there's possibility because of what this is. It is a virus. It does not need your permission to go
Right.
wherever it opts to go. And any traveler, any person can be the host to bring it there. So I mean, we can't stress it enough. We're not out of it yet. And the
Hmm.
summertime is just like New Year's, Christmas, Easter, when we were knee deep in the pandemic. Every holiday, people gave it a 2 week. It was like a 2 week waiting period because you knew the numbers was going to rise. The same thing is
Hmm.
going to happen with summer. Summer is going to every 2 weeks. Summer's going to have a waiting period, and people are going to start looking out for those numbers because they know you have now decided that you're by what is it, July? The city's going to be open 100%. You know, so what is that really going to look like?
Hmm.
We're part of the United Nations. We're part of a whole lot of organizations. Our job is to help them like their job is to help us,
Hmm.
you know. And so we can't just say, well, you know, just leave those people, just leave them and let them deal with it on their own. Because we have to remember, doctors and nurses came from all over the world into New York
Hmm.
because New York was surging so ferociously. Doctors, nurses, medical personnel came from all over the world to assist us because our medical personnel was so worn out. Doctors spending 18 hours in the hospital working is not abnormal,
Mm-hmm.
because we've always had been short staffed on medical personnel. But when you talk about during pandemics, people were like working 24 hours a day, working in their sleep, working with their eyes closed. And people just came in and off and they helped. And now it's time for us to help them. Now it's time to help them. And I don't think that's out of the way to say, hey, you keep looking at this segment trying to get these people vaccinated. A lot of people don't even want to get the kids vaccinated. You know, we gotta look out. Am I my brother's keeper? Yeah, yes, you are. Because we be the first ones looking for somebody else to help us. When it happened here, where's the help? Where's the help? The help came. Those people put their families, they left their families, they left their countries, they left their whole life as they know it, and came over here to what could have been certain death, the way people were dropping like flies here.
Mm-hmm.
But they came, and now it's time to reach back and help them out.
Mm-hmm.
So, America, do the right thing.
Do the right thing. That's a good place for us to wrap this thing up this morning. So we're here. We're going to continue to be here as long as there's stories to be told, and we're not running out of them. That's for sure.
No, that's not going to happen.
The other thing that's interesting is that there's more talk heating up about really tracing the origins of the virus, and there are more and more people that are, you know, questioning the source of it as to whether it was from a lab origin. And so it's actually kind of moved out of the only the conspiracy theorists are talking about it, but they're talking about they've got like real scientists saying, well, look, we're not saying that this is a conspiracy theory, but it is there is some evidence to think that this thing kind of came out of a lab. And this is not really a topic that we have really delved into because I think it's not really relevant to our main purpose, which is getting information out that's actionable. And the bottom line is without more information one way or another, we could sit around all day with conspiracy theorists, but it doesn't really address the issue of how are we going to get from point A to point B in the healthiest manner possible. You know,
Yeah,
I do have some opinions on it, but I'm not going to share it at this time. But we're going to keep an eye on that story as well and see if there is something more interesting to report about that. But it's just, as it is, we're here to share all the information, the good, the bad, and the ugly, to make sure that we can make the best choices for ourselves.
absolutely. Because our focus has always been, not to make that call, not to have to
Mm-hmm.
make that call, build that immune, share pertinent information,
Mm-hmm.
ourselves alive, keep ourselves healthy,
Mm-hmm.
get information out to our community so that we can continue to thrive.
Right. Mm-hmm.
That has been the focus of this show,
Right.
and
And
I'm
and 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 I, my own commitment is to um, really do more coverage talking about COVID recovery. I feel like this is the area where we're hearing the least amount of information, and so that we can add more value by starting to really dig down deep and find out what people are saying and what people are doing. What does the data say? And also just advocating to make sure that in our conversations with our health officials to say, look, okay, it's great. This country um, created this tremendous effort to get everybody vaccinated, but that's not the whole story. Vaccination is about prevention. We have 32 million people who already got COVID, and it's not like, okay, we got the vaccine now, everything's good. What are those health needs going to be? How is it going to impact our already weakened healthcare system that we already saw the inequities in terms of race and class, in terms of the delivery of medical services. And how is that going to play out now with an additional 32 million Americans who are in some form of recovery?
And people still fighting the American Cares Act.
Yeah.
Still fighting it. I mean, at what point do you stop beating this dead horse? And at what point do you realize that every American has the right to live?
Mm-hmm.
Whether they can afford to live or not, they have the right to live.
Mm-hmm.
And it's really something even to hear the story of someone who's, considered a long hauler, people who ran marathons, people who rode miles and miles and miles weekly on their bikes. And
Mm-hmm.
now all of a sudden, that's got to be crazy. It's one thing to have an illness where anything can happen. I've lived like that all my life. Anything can happen at any time. And I've come to grips with that. But now you got people that are healthy who have done all these different things and continue to do these things. Now all of a sudden, they can't get out of bed. They can't walk 5 steps. I mean, literally. Can't take 5 steps without stopping and holding their knees and, taking deep breaths. And, they can't lift their arms. They can't participate in activities of daily living. All of a sudden, you know, that's got to be so overwhelming. And when you have those situations, it's people don't understand. It's very little help available because people just don't understand. People are more likely to try to diagnose you and play Facebook, Dr. Welby, than to be helpful and assist them. What can I do to help you?
Mm-hmm.
How can I make it easy on you? Or people say, oh, you just exaggerating, you'll feel better tomorrow. And so what happens is that causes that person to pull back. And now you have to deal with that. You have to deal with anxiety. You got to deal with all of this stuff on your own because people just don't know how to just simply care, understand, and help as much as I can and be quiet. Just be quiet. Don't start trying to diagnose people. Don't tell them, oh, you exaggerating. Oh, you'll feel better tomorrow. What can I do to help? People are going to be struggling with that. We don't even know. It could be for a lifetime. We don't know. Because
Mm-hmm.
there's no um end in sight for them. You have people that has these conditions and they seem to be getting worse. They're not going away. They don't know how to help ease the pain. You go into doctors are like, I don't know. So people are going to need more help than ever before. And this is the time when we really need to learn how to, you know, just be quiet and listen to people.
Mm-hmm.
And don't, and they don't need you to validate them.
Mm-hmm.
You can't validate them. You don't know what they're feeling. But this is the time when people are going to really need for their own mental health that may not have been um, hampered even during the pandemic. A lot of us made it through. We found ways to check our mental health on a regular basis.
Mm-hmm.
But their mental health may not been affected. But now it very well can be simply because of lack of support. Because let's face it, when they go to the doctor, very few of them are going to get any answers. So they need all the loving support and more. What can I do for you? How can I help you?
Mm-hmm.
Make it easier for you. This is a time of compassion like never before. It's going to take a lot of compassion for a lot of people to be able to continue to live as a result of this.
Mm-hmm. That's it. All right, so we'll be back to talk about all those issues. You brought up mental health. I think we really need to spend some time talking about that. That's something we haven't delved into. I saw something else this morning that during COVID there was a surge in overdoses, particularly in the
Oh yeah.
opioids, fentanyl, and some of these other opioids. So people are, doing other things to try to cope with it, and that really speaks to the mental health challenges of the isolation and just the stress and pressure of not knowing what's going on, not working, not knowing how to pay your rent, and dealing with uh, illness and death in your family. There's a lot people have been going on with, and not to mention the political strife of 2020. So mental health is a big issue, and we'll probably cover that a little bit more in some of our coming episodes. But for now, we're just going to say, we're glad that you're here to listen to our broadcast, and just live your life.
Yep. Live it to the fullest. Don't live it selfishly.